Huples Cat. It's the end of April and we're looking forward to May. So there's been a few things changing at work and I'm just going to quickly tell you about them. I'll maybe shoot some footage when I go back to work tomorrow. I'm only on one day off. I don't feel great, I feel tired, but there you go. So the first thing is some kind person's been sewing hats for us and everybody's now got these, and Kitty got me mine. Mine is a Hogwarts hat and I can't stand Harry Potter, but anyway. Basically this is what they are. It's a sheet of linen with a couple of straps, and the idea is that you don't get nasty COVID-19 on your hair. So pretty much everybody's wearing these. Kitty was the last person to put hers on because Kitty has nice hair. So Kitty actually finally crumbled and now has one, and I will show you that now.
Good, how are you?
Good. You getting a merge patient or not?
Yeah.
What are they?
Trauma?
Oh.
UI head injury?
Where did you get your hat from?
Do you like it?
Where did you get it from?
I think some volunteers made them or donated them.
Oh.
Do I look funny?
They look different.
I look a bit funny.
Look different from what you normally look like.
Everybody's wearing them.
Yeah, I'm not yet though.
It's a bit silly. Are you videoing me?
No.
Go to the bathroom.
So that was Kitty in my office having her break. She was been in charge of the ICU for the last couple of nights and she needs to eat, so she comes to my office. What we're also doing differently now is, because I have an adjoining office that's not used at night, is I'm actually having Kitty sleep in that office rather than sleep in a room with a whole bunch of nurses. A lot of people are sleeping in their cars and I don't think it's great from a security point of view. The hospital's opened up a lot of the cafeteria space that's normally closed for us nights and weekend workers, specifically for staff to sleep in on hard benches, because staff are sleeping all over the spot. So they're now requesting staff don't sleep in waiting room areas, and this makes sense because staff are highly likely to be infected and pass it along to people in the waiting room areas when they open on the day shift. So they're trying to do things slowly, like we're at the end of April, and now starting to address the need for people to eat and sleep on a night shift, which they haven't really to this point addressed. The other major issue we have right now is hand sanitizer. Hand sanitizer remains problematic, so we're being very careful with use, but we still have adequate supplies. But the one thing we ran out of is hand wipes, Lysol wipes if you like, Clorox wipes. We actually don't have any. I actually spent part of last week cutting up square linen to put in buckets to then get hydrogen peroxide to put in it, because we still remain out of bleach in our hospital. The idea of a hospital not having bleach in 2020 is kind of outstanding. The other thing is that I want to talk about is that we are still experiencing a slow and progressive rise in cases every single day. And I'll put a few slides up that are not for reproduction from my workplace, so you can see what we're actually facing in my hospital in Toronto, Canada. We're not facing a sudden surge. What we're facing is a gradual, steady 20 to 25 patients who are required to be admitted, and over half of them are ICU every single working day, despite doing extraordinary things in terms of not having this case surgery and not bringing in people from other hospitals. Bearing in mind we're a major teaching hospital, so a large number of our patients are actually brought in from other hospitals for care. We're starting to resume a little bit of that, but not a lot of that, and so we continue to be very much in what are we going to do mode. The emerge is starting to see a steady rise in the number of patients down there that don't have beds. We managed to defeat that problem entirely by closing down to pretty much everything, but it's coming back, and that's a cause for concern. The other issues that we're facing is the continual calls for lockdown. So far our Premier, our Conservative Premier of Ontario, is basically telling people to get lost. He has a plan, it will be phased. If at any time during the phased reopening we get a spike in cases, we're shutting down again. And no, he's not giving timelines, because how can you possibly look in the future and say it's safe to do it 2 weeks from now? And that's a sensible and sane approach, unlike the approach other jurisdictions and other countries are using, which is to wish this away and decide to reopen and let people die, because that's exactly what they're going to do. And again, the ideology of the market isn't going to work in a lockdown situation. People have to go out to work and earn money, or else they're in deep trouble unless the government subsidizes their wages. And a lot of people are opposed to that because they see unemployment as lazy people's way out, whereas in fact there's over, I believe, 30 million Americans now on unemployment, and there's a large number of Canadians. The difference between Canada and America is most, not all, most of our unemployed are getting a reasonable amount of income. They're not having great times, but they're able to feed themselves and heat themselves and make rent. Not all, but most. And that's a critical difference. If you actually want to have a lockdown, you might as well make sure people can obey the lockdown rules without having to starve or lose their homes. Makes sense to me. So America is going to resume full opening tonight unless the federal government extends the mandated lockdowns nationally in the United States. So we're watching that up here in Canada. We have no plans to reopen our border to the United States. We remain very concerned, very, very concerned about the amount and spread of COVID-19 disease in the United States of America, and I think that's a reasonable concern. The other thing I'd ask you to do is stop eating beef and pork products. If you've got the money and the availability, get vegan substitutes. It's way healthier for you, not completely healthy, processed anything's not great, but it's way healthier for you than processed pork and beef. If you're able to reduce the amount of them that you're taking from the big processors, you're directly going to reduce the demand on the big processors to put immigrants and black people and poor into harm's way. There's huge outbreaks in these meat processing plants, and for obvious reasons. The hygiene there is dreadful. I like the fact that they spray everything with bleach down there because it's a cesspool of infection at the best of times. So if you can, stop buying beef and pork products from the big manufacturers, because they're going to throw people back to work in conditions of outbreak. You know, in a lot of the meatpacking towns and areas, they're doubling caseload every couple of days, and you're literally going to condemn people to death because of your desire to eat pigs and beef products. If you can, get them from local farmers. If you can, hunt your own. If you can't, try and reduce the amount you're having. Really knock on that. Knock on the effect of we're dependent on meat in America and Canada to feed our population. Try and help out the people in the processing plants by reducing the need to throw them back to work with inadequate safety measures. The other thing I encountered this week was I had a couple of floors that are not COVID floors requesting 1 or 2 boxes of N95s at night. Both of those requests I denied. I asked them to tell me which aerosol generating procedures they were planning to do overnight, and their answer was, we have a couple of PUIs. Okay, what aerosol generating practices are you going to do tonight, and how many masks do you need exactly? 1 or 2, I told you. No, you don't get 1 or 2 boxes. This is not normal. So even today at the end of April, hospitals in Toronto, a lot of the nursing staff and medical staff have not comprehended the fact that this is a national emergency that is ongoing and business normals ended. I'm out of masks, I want a box or 2. You're not going to get them. We don't have enough supply just to give you a ton of masks for you to just use and abuse. We just don't have that anymore. And I think that's a really important thing. So I brought that to the attention of risk management, IP&C, and they've clamped down. Again, the problem was some of the patient care managers haven't got this and they want their staff to be safe. So if you make your staff really safe, and I do think everybody should be in an N95, we just can't do that, but if you make a staff safe by widely allowing them to use N95s when there's no actual real need for it. The units that I'm working with that have COVID positive patients that are doing everything they can to limit the use of N95s, that's just disgusting. I'm okay, I don't care about them. So we're really working on that aspect of this. We're all in this together. We've mixed and matched the ICU teams like crazy. There's only a couple of holdouts and they're going to fall. Pretty much anybody on any ICU is going to go level 1, 2, 3 up and down the scale, move around, and we try and support them as best we can. We're having a continuing and ongoing demand of intensive care beds in my hospital without a surge. So I think that's a really important point, is that when you enter an emergency department or you go for a clinic appointment and you see that it's empty, it should be empty because the staff have been redeployed, the staff are set up for a surge. That is where you're seeing it. Now increasingly I'm also seeing a whole bunch of absolutely appalling videos appear claiming that this is not an actual infection, claiming that this is not actually killing people, claiming that the American numbers are artificially raised. All of those things aren't true. In fact, it's the opposite. The other thing I'm going to address in a lengthy video is the attack on China. The blaming of China for creating a bioweapon. This again is magical thinking. This is a natural virus, and it's causing huge immense damage. Did China do things wrong? Yeah. Did the World Health Organization do things wrong? Yeah. Did President Trump? Yeah. Did Justin Trudeau? Yeah. Everybody has done things wrong. The question that is that, are you going to say that the American deaths are a direct result of China and World Health Organization, and that your government had absolutely no role whatsoever in the appalling spread and death rate in the United States? It's a political decision to decide that that's not true. It's reality to say, yeah, your governments, state and federal, largely made huge errors in how they handled this and how they downplayed the effects of this. I'm also going to do a video on the HIV meds. Again, that's been waved around as this magical fix. It isn't. And how it's been presented as a magical fix. It isn't. And I also want to talk a little bit about Project Warp Drive. Great name. Yeah, that's a plan to inject 100 million Americans with a vaccine that hasn't been trialed before the end of 2020. Interesting, and I do want to talk a bit about that. So take care. Let me know what you're doing in your local area, both in hospitals and out of hospitals, to try and make yourself a little bit safer in a time of a pandemic flu influenza, that is going around all of the communities, that is spreading everywhere. I think there's now 6 or 7 countries in the world that do not have COVID-19, and they're all like tiny islands in the South Pacific. So there is nowhere to run, there is nowhere to hide, there is no magic treatment. The only thing we can do as healthcare professionals and as normal people, because healthcare professionals aren't really that normal, as you probably noticed watching my channel, is actually take methods that protect yourself and prevent the spread. And again, if you can avoid buying pork and beef products from the big manufacturers in Canada and America, please do so. I understand that you may have no choice in the matter. If you have no choice in the matter, try and buy a bit less. Try and send a clear signal that we the people will not tolerate our governments throwing our most vulnerable in harm's way to feed us with things that aren't that healthy without coming up with a proper plan to protect the workers, because they haven't. And it's just nonsense to say and pretend that it doesn't affect you. It does. The more people that get infected, the more people that die, the longer this will go on, the iller people will get. Anyway, that's all from me. It's just a quick one. Like I said, I'm dead busy. I'll be working the weekend, and I'll try and get some videos up next week that are more lengthy and more pointed. But next week is next week. Could be sick by then, so could you. Anyway, take it easy. Toodles. This has been a slow-moving Hungry Cherry production 2020.